Q1. Which can replace N2O as O2 carrier? A. Argon, B. Xenon, C. Helium, D. None. Correct answer C. Uns. C. Helium. Helium can be used to replace nitrogen as the carrier gas for oxygen to reduce the work of breathing. Question 2. Addition of epinephrine to lignocaine. A. Increases distribution of L. B. Decreases absorption of L. C. Decreases duration of L. D. Increases metabolism of L. Answer B. Uns. B. Decreases absorption of L. Vasoconstrictors are used along with La, which prolongs duration of action as rate of absorption is decreased due to vasoconstriction. For the same reason, metabolism of La is reduced and toxicity is decreased as there is lesser absorption of La. Question 3. Maximum concentration for epidural block? A. Bupivacaine, B. Lidocaine, C. Ropivacaine, D. Clopidogrel. Correct answer D. Clopidogrel. Question 4. All are contraindications of spinal anesthesia except A. Bleeding disorder, B. Raised intracranial tension, C. Hypertension, D. Infection at injection site. Correct answer C. Hypertension. Question 5. For prevention of headache during spinal anesthesia, A. Diluted solution of local anesthetic should be used, B. Preloading with crystalloids, C. Finer IP needle should be used, D. Head end should be elevated. Correct answer C. Uns. C. Finer IP needle should be used. As single most important predisposing factor is large bore needle, use of fine needle prevents PDPH. Question 6. In newborn, chest compression should be started if heart rate is less than A. Less than 120 per minute, B. Less than 100 per minute, C. Less than 80 per minute, D. Less than 60 per minute. Correct answer is D. Less than 60 per minute. Question 7. Murphy's eye is seen in a Macintosh laryngoscope, B. Endotracheal tube, C. LMAD flexible laryngoscope. Answer B. Endotracheal tube. The Murphy eye is the eponymous name for a hole on the side of most endotracheal tubes, ETTS, that functions as a vent and prevents the complete obstruction of the patient's airway, should the primary distal opening of an 8 become occluded. Question 8. During squint surgery, anesthesiologist sees the machine and see the BP suddenly drops to 40. What will be best immediate management? A. Give atropine, B. Increase level of anesthesia, C. Ask the surgeon to stop the surgery, D. Give adrenaline. Correct answer is D. Give adrenaline. Question 9. A 6-year-old boy taken for ophthalmic examination under anesthesia. His father told that he has lower limb weakness or his elder brother died at 14 years of age. Which anesthetic drug has to be avoided? A. Succinylcholine, B. Pancuronium, C. Atracurium, D. Dexicurium. Correct answer is A. Succinylcholine. Succinylcholine is a depolarizing skeletal muscle relaxant. It causes sustained partial depolarization of muscle end plate, greater than initially produced twitching and fasciculation followed by flaccid paralysis. Question 10. Shortest acting non-depolarizing muscle relaxant is A. Mivacurium, B. Doxasuronium, C. Pipacurium, D. Vecuronium. Correct answer A. Mivacurium. Succinylcholine, succinylcholine, is the shortest acting skeletal muscle relaxant. O. Mivacurium is the shortest acting non-depolarizing skeletal muscle relaxant. Question 11. A patient undergoing a minor surgical procedure is given lignocaine injection. Assertion: local anesthetics acts by blocking nerve conduction. Reason: small fibers and non-myelinated fibers are blocked more easily than large myelinated fibers. A. Both assertion and reason are true, and reason is the correct explanation for assertion. B. Both assertion and reason are true, and reason is not the correct explanation for assertion. C. Assertion is true, but reason is false. D. Assertion is false, but reason is true. Correct answer is B. Both assertion and reason are true, and reason is not the correct explanation for assertion. Question 12. The following increases intraocular pressure: A. Thiopentone, B. Aldacine, C. Ketamine, D. Barbiturate.
Correct answer is C. Ketamine.
Question 13. Which is a safe muscle relaxant in renal failure? A. Cisatricurium, B. Rocuronium, C. Vecuronium, D. Succinylcholine.
Correct answer is the cisatricurium. The unique feature of atricurium and cisatricurium is inactivation in plasma by spontaneous non-enzymatic degradation, Hofmann elimination, in addition to that by alkaline ester hydrolysis. Therefore, both of these do not require hepatic or renal routes for elimination, therefore can be used safely in hepatic and renal failure. Moreover, cisatricurium does not provoke histamine release. Therefore, it is preferred over atricurium.
Question 14. Midazolam causes all except A. Anterograde amnesia, B. Retrograde amnesia, C. Causes tachyphylaxis during high-dose infusions, D. Decreased cardiovascular effect.
Correct answer B. Answer B. Retrograde amnesia. At the time of peak concentration in plasma, hypnotic doses of benzodiazepines, midazolam, can be expected to cause varying.
Question 15. Shortest acting local anesthetic agent is a Pricaine, B. Lidocaine, C. Tetracaine, D. Bapavachan.
Correct answer is a Pricaine. Question 16. At the end of anesthesia after discontinuation of nitrous oxide and removal of endotracheal tube, 100% oxygen is administered to the patient to prevent a. Diffusion hypoxia, B. Second gas effect, C. Hyperoxia, D. Bronchospasm.
Correct answer is a diffusion hypoxia.
Question 17. All of the following cause myocardial depression except A. Halothane, B. Etomidate, C. Thiopentone, D. Ketamine.
Correct answer is B. Etomidate. Etomidate causes adrenocortical suppression by inhibiting enzymes 1/3 hydroxylase, mainly, or 17-hydroxylase involved in cortisol and aldosterone, mineralocorticoid, production. With C supplementation restores cortisol level. Etomidate and midazolam provide cardiovascular stability. But etomidate is most cardiostable agent that causes the least hemodynamic disturbance of any of the intravenous anesthetic agents. So it is intravenous anesthetic agent of choice for patients with cardiac disease and aneurysm surgery.
Question 18. Claudication due to popliteal femoral incompetence is primarily seen in A. Thigh, B. Calf, C. Buttocks, D. Feet.
Correct answer is B. Calf. Question 19. Pencil in cup deformity is seen in A. Rheumatoid arthritis, B. Ankylosing spondylitis, C. AVN, D. Psoriatic arthritis.
Correct answer is D. Psoriatic arthritis. Question 20. Cholera toxin is due to A. Chromosome, B. Plasmid, C. Phage, D. Transposons.
Correct answer is C. Phage. Question 21. Most common type of shoulder dislocation is A. Preglenoid, B. Subcoracoid, C. Subclavicular, D. Posterior.
Correct answer is a preglenoid.
Question 22. Ketamine can be used in all of the situations except A. Status asthmaticus, B. For analgesia or sedation, C. Obstetric hemorrhage, D. Ischemic heart disease.
Correct answer is a Status asthmaticus.
Question 23. Lithium causes all except A. Polyuria, B. Nephropathy, C. Epstein's anomaly, D. Hypothyroidism.
Correct answer is D. Hypothyroidism.
Question 24. Which one of the following sets of components of cigarette smoke is a causal agent of coronary artery disease? A. tar and nicotine, B. Nicotine and carbon monoxide and tar, C. Carbon monoxide and tar, D. Carbon dioxide.
Correct answer is B. Nicotine and carbon monoxide and tar. Question 25. A boy met with a motorbike accident. CT brain shows injury to the posterior end of the superior temporal gyrus. He is likely to suffer from a fluent aphasia, B. Non-fluent aphasia, C. Conduction aphasia, D. None of the above.